Welcome to this episode of Patient Voices in HIV Management, a CE podcast series. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the show notes that can direct you to this information. After listening to the podcast, please go to practicepointcme.com to complete the post-test and evaluation to receive continuing education credit. Joining us in this episode is Dr. Julian Gold and his patient, an MSM with HIV, discussing stigma, health, and ART.
My name is Dr. Julian Gold. I'm a senior staff specialist at the Albion Centre in Sydney, Australia, and a clinical professor at the University of Sydney. And I'm here to have a chat with one of my very long-time patients who we've been seeing each other now for many years. And I'd like to introduce him.
Hi, Julian. How are you?
Very well, thanks. What we'd like to just talk about are things to do with your HIV diagnosis and when you started on antiretroviral therapy and some of the medications you're on and their effects. So let's get started. And the first thing is I'd just be interested in what happened before you had a positive test. Did you perceive yourself to be at risk of HIV at all?
So yes, I did. So it was in 2008. I knew that I was sometimes having unsafe sex. I was living in London at the time, and I was sort of going out quite a bit. And I was with someone who I knew was positive, and they told me they weren't very good at taking their treatment. And I suppose at that time, I didn't realize the impact that would have, because we knew at that stage a lot less about things like undetectable viral load and things like that. So I didn't realize that possibly this person not being on treatment had a high viral load, and that also put me at more risk. And obviously because I had been unsafe, which was my responsibility.
So what did becoming positive mean to you?
Yeah, so I had a lot of friends who were HIV positive, and so I was really quite educated around the medical outlook. I had never stigmatized people living with HIV, but I was still really shocked. I still found it probably more difficult than I expected. I think there was a lot of shame in terms of why did I allow myself at this stage of my life to, get a diagnosis? Why was I being careless? And I also needed to learn what it would be like to now navigate my life living with HIV. So it took me by surprise that it impacted me a little bit more than I expected.
So it was 15 years ago. What were the interactions with the healthcare people that you were dealing with?
They were excellent in terms of just the nurses, they were really fantastic. They were really helpful. And they did offer me counseling straight away. Of course, in those days, you didn't go straight away on medication. They did offer me counseling. And I remember saying 15 years ago, no, I want to take the drama out of it. But I think that was more denial than anything else. And they said, okay. They said, well, we'll give you some books to read about HIV. And I took the books home, and I literally, obviously, I didn't want any of my friends to see. I hid them under my clothes. And I think that was sort of like made me realize, and when I thought about that afterwards, I was actually just not ready to face my diagnosis.
Now, just when you started on treatment, what issues were you thinking about, and why did you actually start on treatment? Did you discuss it with your in the UK, or what actually happened?
When I seroconverted, I had like a really, it really impacted me a lot. And I think I started with a very high viral load. So I think my body was struggling to like basically, cope with the HIV, my T cells, things like that. So I went to um, back to the John Hunter Clinic and I said, I feel like something's wrong here. And they did some tests on me and they found that my blood count was down quite a lot. And they basically made a decision to put me on medication straight away. So it wasn't something that like I discussed or chose with my doctor. They pretty much said, you need to go on meds. Your health is being impacted. And I'll be honest, it was fantastic because within a few days, even, or a week or so, I can't remember, but I know quite soon, I just started feeling so much better and so much more healthy.
Just going back to when you started on treatment, how did you incorporate it into your life? Did you find it a challenge, or was it just part of how you were?
Yeah, look, I think it wasn't that difficult. At that stage, I've been on 2 regimes in my entire HIV career, let's say, and this was the first one. There were 3 meds that I had to take. I knew it was good for me. I immediately felt better. I knew it kept me well, and it became, such a standard part of my life that I actually needed to buy one of those pill boxes with 7 days because my biggest problem was, oh, I think I've taken it already. Have I not taken it? Because, the tablets were sitting around. So I put it in a pill box and I found that was helped me not need to be anxious around whether I had taken them or not.
Those pill boxes are generally a very good idea. Some people think that they can just remember, but the pill boxes really seem to help a lot. Just
Yeah.
did you get any side effects when you started on therapy?
Look, it's such a long time ago, but I do recall just in the short term, I think there was a little bit of stomach upset, but it did resolve itself quite quickly.
Okay. So you went along with the first regimen,
Yeah.
and that was no problem. What led you then to think about changing regimes? Why did you go? What led you to that?
So it was on the advice of my doctors. I can't recall if it was you or just the person I saw just before you. So I just trusted them that it was in my best interest. I didn't have any concern switching, and I just felt this was a good decision for me.
Yeah, I think that was me. That
Oh, okay, good.
that we talked about that, and it's clearly always easier to try to take one tablet a day than 2 or 3 different tablets. So,
Yeah.
uh, did you ask other people? It's quite usual that that before somebody changes treatment, they talk about it with other people, get some support, and find out what was going on. Did you do that at all?
Yeah, so look, I definitely had. I don't know around that, but just generally, have a network of positive friends, and I think it's really good for people living with HIV. It's really helpful to have other people who have the same lived experience, and we would often talk about different medication or what I think our doctors are saying.
And how's your general health been since you've been taking this new medication, or the medication in general?
So I think what really has helped me is the advice that my doctor gave me when I was diagnosed in terms of keeping myself healthy. So I'm 61 years old. I eat really well. I don't drink too much. I don't smoke. I do lots of exercise. I swim. I walk my dog. I go to the gym. And and I think you and I actually, saw you yesterday, and we went through all my all my sort of, health things. And obviously, as a person living with HIV, you have the benefit of seeing your doctor checking on your health every 6 months, and that's a huge advantage. And my health is really good. My medication has worked really well to keep me healthy, as well as me working on making sure I'm looking after myself.
Yeah, that's absolutely true. And I think even back in those days, your doctor gave you very good advice. It's really a partnership between the medication and you. You have to keep yourself generally well and healthy and look after yourself, and then the medication can work even better and do its part.
Yeah.
Just these days, people talk about, or they always have talked about, a lot of different options with medication. And within your group of friends, do you talk about what's available and whether people want to change? And are they actively going to their doctors and asking to change medication?
So you hear all these sort of general discussions by community, but sometimes it is to do with lifestyle, not the medication, and it is sometimes hard just to know, what's sort of the truth or not. And the other thing is, obviously, some people are talking about, whether they want to use the injectables and things like that. That's something that's definitely talked about at the moment. So yeah, around my positive friends, there is always a discussion, but I'm not, to be honest, I'm not too influenced by my friends, because for me, it's like, what is working for me, what in discussion with my doctor who knows, my health risks and things like that. What for me, that's where for me, that's how I make my decision.
Excellent. Now, let's just go on to another topic now, which I know is very close to you, and
Yep.
that's what you do. You work for the AIDS Council. So
Yeah.
can you give us a little background as to what you do, how you got into it, and the lessons that you've learned from working in the field that you are?
As I said, when I was diagnosed, I didn't really talk to anyone at first, and it was by getting support and getting involved with other people living with HIV that I realized how helpful that was for me. So when I did return to Australia, I decided that I was already doing work like this in the UK. I was already volunteering. And I decided that what I wanted to do was to actually support people living with HIV or recently diagnosed, and help them come to terms with their diagnosis, and come to terms with living with HIV by the benefit of speaking to other people with lived experience.
And how's it working for ACON? How's that impacted on you?
Yeah. So that's had an incredible positive impact on my life. Firstly, I've learnt and met so many wonderful, insightful people with diverse experiences and perspectives. And so that I have learned that by helping other people, I also learn, and I actually help myself, because I learn from people and people say things to me. And I think, wow, that's just a really good perspective on living with HIV, and I share it with other people. I'm there to try and make people feel really safe, to make them feel really supported. And yeah, I just get a lot from helping other people, and it's definitely impacted me a lot in my life.
That's excellent. Thank you very much. And just over the years, have your thoughts about HIV or treatment changed, developed, or pretty much stayed the same?
No, so it's definitely changed. And sort of like, if you like, sort of like key messages that I sort of like I've learned is, one, that you're healthy, that, and this is around things like stigma. And this was something a client once said to me, and it's like, don't let anyone take your power away. The other thing I've learned is, and I think this is really important for people recently diagnosed, is Well, there is a lot of HIV stigma. Often more people are your allies and will support you more than you would expect. And sometimes you might have a bad incident, but don't let that hold you back, because it's the expectation of some people that are, like thinking that just I had one incident, so I can never share this with someone, with partners, things like that. But there are going to be a lot of people who will not judge you. And I think probably the other thing I'd sort of want to share is that often people with an HIV diagnosis, self-stigma is the most difficult thing. Often people are judging themselves. And often that, as I said, it's less what other people are thinking, it's what you're thinking about yourself. So I'd sort of finish by saying, and I think I said this earlier on, right at the beginning, something I didn't do is you need to face your diagnosis straight away. HIV is like a very small virus. We get it down to an undetectable level, but it still has too much emotional size or energy. And so it's a little bit about building up your resilience, getting stronger, which is really good in any person's life in terms of having a healthy mental health, is in terms of how you deal with when you have a big challenge in your life.
Well, thank you very much for giving us your thoughts on that. Some of the advice, or most of the advice, has been really excellent. Certainly for me, I think just talking to your doctor is very good. But also, I think the opportunity to talk to your peers and get advice and support from your peers is also equally very important. But I think the key thing that you really highlighted here is the importance of keeping yourself healthy. I think the medication is essential to keep the virus undetectable, but your general health really is most important in order to keep yourself healthy and to have regular checkups. So thank you very much. I think your overview and what you do has really given people an insight into both what it's like to have HIV, to live with HIV, and also to support other people that have HIV and how important that is. So thank you very much, and that's been an excellent review.
Thanks very much. I appreciate that. Thank you.
Thank you for listening to this episode of Patient Voices in HIV Management. Please go to the activity page on practicepointcme.com to complete the post-test and evaluation to receive continuing education credit.